The perceptual therapy system test consists of 3 separate parts: visual closure, To Kistoscope, and visual span. In visual closure, what we're looking at is how somebody's able to close these pictures in their head. And you can see it starts with simple numbers and it's pixelated. And what we're looking for is how quickly can somebody kind of guess or figure this out as quickly as they can. The faster somebody's able to do this, the better they are, and they're able to move on to the next task. And that's why we call the small words sight words, like was or is or of or the. We don't want to have to spend a lot of time with that. We want to be able to look at those words quickly, see those words, and then move on, and would spend the energy on longer words like interested or house or however. Here you can see uppercase letters. There's testing with lowercase letters, pictures, images, and these are norm tests. And what that means is we compare an individual relative to other people that age. So we're able to compare a 6-year-old relative to what's normal for other 6-year-olds that are in the database. Somebody who's 15 will be compared to other people that are that age. Here you can see the pixelation, and what we're asking the patient to do is, as quickly as possible, see the picture in their head, figure it out, and then be able to move on. When we go to results, you can see in the top part, we're going to be able to see the results of that testing. In the next part, called the To Kistoscope, what we're going to be doing is we're measuring how quickly can somebody bring in visual information. For example, looking at the board, it starts out real simple with 1 digit. Patient is given 2 trials. If they're able to do it, then it moves on to 3 digits. You'll notice that the number is shown very quickly, and the subject has to be able to respond to that, see the picture in their mind's eye, and respond to that. And you can see now it's 3 numbers, and it continues on 3, 4, 5, 6 digits. And here too, this test is normed, meaning it compares an individual of the same age relative to thousands of other people who are the same age. It'll give us a percentage, meaning is this person in the 10th percentile, the 90th percentile, the 50th percentile? And what that means is we're comparing one individual relative to thousands of people of that same age. Somebody in the 10th percentile, what that means is, imagine that there are 100 people walking through a door. Somebody in the 10th percentile has to wait until 90 other people walk through that door before they walk through. In visual span, that visual span test is a little bit different. And what it's doing here is it's looking at one number and then a second number and then a third. And you'll see what I mean in just a moment. You can see now there's just one number. And now you can see that there's a sequence of numbers. So first, the first number shown, and then the second number. And you have to have that picture in your head and put those 2 together. Well, why is that important? Well, the reason that's important is because we're not only looking at a word, we have to connect the word that we're reading to the word prior to that, to the phrase prior to that, to the prior sentence, to the prior paragraph, to the prior page, and we have to put that in a sequence. Otherwise, we don't really understand what the author is writing to us. This test is also normed, so we compare an individual relative to thousands of other people of that age that are already in that database.